Today's topic is about how to detect lung cancer early. So, how did lung cancer start? Just like other type of cancer, it starts off with one or a few small cancer cells, and then these cells divide and multiply into multiple other cancer cells, and then these cells spread to other part of the body. On imaging for early lung cancer, you will see a small nodule, like the picture on the left-hand side. When lung cancer gets to the later stage, it will manifest as a large mass or multiple other cancer spots throughout the body. So, how do I know if I have lung cancer? Early lung cancer is very challenging to diagnose because there is no symptoms. The patient can function normally like other patients without any symptoms like cough or shortness of breath at all. When the cancer gets larger and involve other structure of the lungs, such as the pleura, the bronchial, or the trachea, then lung cancer start to have symptoms such as cough, coughing up blood, shortness of breath, and etc. Late-stage cancer can also manifest as significant weight loss and fatigue. So early lung cancer doesn't have any symptoms. So why do we have to detect it early? The reason why is on this table. So the earlier lung cancer is detected, the longer survival the patient would have. As you can see, lung cancer stage 1, when the nodule is less than 3 centimeters, survival can be up to 80%. When it gets to a stage 3, which is usually when the nodule or the mass more than 5 centimeter, the survival in 5 years only 20 to 30%. Another interpretation of this table is that every 1 centimeter nodule growth means a 7% less of survival rate in 5 years, and this is striking. The clinical question would be, of all these people in this crowd, how do you detect lung cancer? To answer these questions, we have to come back and ask ourselves, what causes lung cancer? Coming to the top is tobacco. Tobacco contains 4,000 chemicals that can cause different kind of diseases and especially cancer. When someone uses tobacco for a long time, it increases 20 times the risk of lung cancer. The second less common cause of lung cancer is radon gas. Radon gas is the odorless gas that released naturally from the rocks, water, or soil, and then it will build up in the house of someone through holes or cracks on the floor. Radon gas estimatedly causes about 12% of lung cancer in the United States. And the third common cause is asbestos. Asbestos is found commonly in the insulation material in the ship or construction building. Is lung cancer hereditary? The answer is possible, but there are so far only a few genes that discovered that can cause lung cancer in the family. In the past 15 years, there have been multiple studies that published in the field of lung cancer screening as the diagram below. The most well-known study is the National Lung Cancer Screening Trial that was performed in 2011 with over 50,000 of the patients. They selected all the patients with high risk of lung cancer. These patients smoked 30 pack years, which means on average 1 pack per day for 30 years, and quit in less than 15 years ago. And then they compare the CT scan versus chest X-ray to screen for lung cancer. After the study period, they found a lung nodule percentage in the chest X-ray group of 7% to 16% of the patients. And all of these patients with lung nodule, only 5.5% are actually from lung cancer. The CT scan group detects more lung nodules of 24% to 39% of the patients found to have lung nodules. And of these, 3.5% of these patients have lung cancer. After the study period, there is a significant decrease in lung cancer-related deaths in the CT scan group, and amazingly, there is also a significant decrease in all-cause mortality in the CT scan group. In another word, there are 3 deaths averted after 1,000 people screened annually in the 3 years period. This study proves that lung cancer screening in high-risk patients is something that's feasible and meaningful for the high-risk population for lung cancer. The second landmark trial is the Nelson trial that was recently published. It compares CT scan screening versus just regular exam screening for lung cancer. The high-risk population in this study is defined as people who smoke more than 10 cigarettes a day for 30 years. This study uses a more restrictive criteria for positive finding, which not only includes the size of the nodule, but also includes the volume and the growth of the nodules. The result of this trial is also kind of similar to the result of the other trial. In high-risk men, the lung cancer mortality risk is significantly reduced by 24% at the 10 years period. Moreover, lung cancer screening has even more favorable results in women, where it proves that lung cancer screening by CT scan reduces up to 60% of the lung cancer death in women with high risk. These important trials set forth to the recommendation from the official guideline from the United States Preventive Services Task Force. It is recommended that all the adults with high risk of lung cancer, including smoking history more than 20 pack a year or 1 pack per year for more than 20 years, or quit within 15 years, are screened for lung cancer by annual CT scan. I'd like to touch a little bit about radiation exposure for lung cancer screening. Yes, to be screened for lung cancer, there will be an exposure to radiation. However, the radiation dose used for each CT scan is only 1/5 of the regular CT scan, and this dose of radiation exposure is similar to the dose of radiation we are being exposed for 6 months living on Earth. The benefits of lung cancer screening is still significantly higher than the risk of radiation exposure. Thank you for watching. Goodbye.